Seb Miller here again, your family doctor online. I'm just going to answer a few questions that have been coming in for today. So do you want to fire away with the first one, please, Zainab?
Yeah, sure. So Dr. Miller, a lot of
Yes.
people have been having the cold and the flu, but they're just wondering what are some of the symptoms they should worry about in terms of COVID-19?
Well, first of all, you have to look at your background risk. Okay, so to know if you have COVID-19, you have to do a PCR test. There's no way of knowing otherwise just by thinking that you have the flu or a cold that you have COVID-19. So the background risk is the key thing here for figuring it out for yourself.
All right. And
So if you've been abroad or been in contact with a COVID-19 case, then
Yeah.
obviously your risk is much higher. If you haven't been abroad or haven't been in contact with a COVID-19 case, your risk is much lower. But it's all statistics. It doesn't mean that you don't have it. So basically what you can do, I'll put a link down below and you can run a little test that'll be, that you can click into. It runs in a few languages and you can see if you're high risk, low risk or medium risk. So the key thing here is to know what to do. That's really the question that you're asking. So
Yes.
like I've got a cold, I've got a runny nose, what should I do?
yes.
And this is the real answer that you're looking for. So if you've got a cold and you've got a runny nose and you think, well, do I have COVID-19 or not? Stop right there and just say, what can I do to prevent other people from getting my cold? And who is most vulnerable if they were to catch this cold from me? So if you have anybody at home who's over 60 years old, they have to be very careful that they don't catch this cold, whatever the cause is. If you have anybody at home who's pregnant carrying a baby, they should also not catch this cold from you. And in order to prevent them catching this cold, we do a thing called 1, social distancing. 2, wearing gloves. 3, wear a mask like this one. You can order one on Amazon and we'll put a link down below because the government is trying to make sure there's a steady flow of masks. Number 4, wash your hands all the time. Number 5, don't put hand to mouth. Those are simple things that you can do and all your family can do to prevent the cold from spreading. The initial symptoms are the symptoms you would expect from a cold. Maybe a bit of a headache, maybe a little bit of a temperature or a fever, possibly a tickle in the throat and a cough. Perhaps you're having some rhinitis and blocked nose, runny nose. These might be the simple beginnings of a COVID-19 infection. But the question you ask as well, which is very important, is what are the symptoms I need to worry about? So if you're getting a high fever, sitting up over 39, you should probably be speaking to your doctor. Try virtual care first rather than going into their center. If you're knocked off your feet and extremely tired and fatigued, probably you should be worried. You should also be talking to your doctor on virtual care or online if you can. Then the next thing, if you have any background vulnerabilities, like if you have a high level of sugar or high levels of, if you have any problems with your immune system, then you should also be worried as well. So all of these are what we would call red flags. And thank you very much everybody for dropping in. You can add your comments down below. We'll be happy to answer. If you've got any pearls of wisdom to share, put them there. And if you've got any questions, fire away.
All right. Thank you, Dr. Miller, for your time.
Thank you.
Guys, below, write down your comments for us. Don't forget to subscribe and hit that notification button. Thank you.